Hi, everyone. I'm Maggie McGrath, editor of ForbesWomen. On June 24th, the U.S. will observe the second anniversary of Roe v. Wade being overturned. And in honor of the occasion, women are going on strike. Here to explain exactly what this means and the effect it could have on society is author and sociologist Jessica Calarco. She has a new book out called Holding It Together: How Women Became America's Social Safety Net. Jessica, thank you so much for joining us.
Thank you so much for having me.
Now, you have said somewhat famously in women's circles, or at least in my world, that other countries have social safety nets, the U.S. has women. And you argue that it's kind of intentional and systematic that women have become the social safety net in the U.S. Before we talk about the women's strike, can you break down that thesis? Why is it that you say this?
Yeah, so essentially, other countries have invested in social safety nets to help people manage risk. They use taxes and regulations, especially on wealthy people and corporations, to protect people from falling into poverty and precarity, to give them a leg up in reaching economic opportunities, and also to ensure that everyone has the time and energy to help take care of their communities and their families and their homes and even themselves. Whereas in the US, we've instead tried to DIY society. We've kept taxes low and slashed huge holes in the safety net that we do have. And we've told people that if they just make good choices, they won't actually need a social safety net at all. And the problem there is that people do need a social safety net. Forcing people to manage that much risk on their own has left many families and communities teetering on the edge of collapse. And yet we haven't, in part because we have women holding it together, filling in the gaps both in our economy and in our social safety net. So women are the default caregivers for the children, for the sick, for the elderly. And they're also the ones who are disproportionately filling the lowest paid jobs in our economy. Jobs oftentimes in essential service sectors that are too labor intensive, but also too necessary to be both kind of profitable and broadly accessible. Jobs in childcare, jobs in home health care that other countries have funded as part of the safety net instead. And so what I show in the book is that women's unpaid and underpaid labor is helping to maintain this illusion of a DIY society and making it seem as though we can get by without investing in the kind of social safety net that many other countries take for granted.
You've also written that billionaires and big corporations, for-profit corporations, have effectively bought politicians that embrace their view of a DIY society. So how much blame do we have to give billionaires and big corporations for the state of affairs right now?
I think we can trace it all the way back even a century. In the book, I trace this back to the 1930s and to the reaction of wealthy people and corporations to the New Deal, to Franklin Roosevelt's policies put in place in the wake of the Great Depression, which was where we first saw kind of increasing corporate tax rates as a way to fund this kind of stronger social safety net, things like Social Security and Medicare. And at the time, those wealthy people and kind of big business elites were looking for ways to persuade the American public that we didn't actually need a social safety net, that we could get by without one. And what they found at the time was essentially neoliberal philosophy. A group of economists in Austria who were developing this idea that countries don't actually need social safety nets and are actually better off without them, because people without that protection will keep themselves safe from risk. And this idea has been widely debunked over time, but it was used to fuel kind of decades-long propaganda campaigns, to shape decades of US social and economic policy, and to create this sort of perception that we didn't need a social safety net, which many people in the US continue to believe today, despite the evidence that this is causing harm, and particularly causing harm to the women who are trying to pick up the pieces and hold it together instead.
Now, you've articulated the lower paid jobs that women hold, the caregiving responsibilities, paid and unpaid, that women hold. Let's talk about this women's strike. The organizers of the Women's March have said that women and girls and allies should withhold their labor on June 24th, the second anniversary of the Dobbs decision. How effective could this be? Or let's start with a simple question. If everyone were to participate, what would happen? Would society crumble to a halt?
I mean, we can look in the book. I talk about a parallel example. There was a women's day off, they called it, that happened in Iceland in the 1970s. And essentially, what happened at the time was what the organizers of this contemporary women's strike are calling for, in the sense that women took the day off not only from paid work, but also from caregiving responsibilities. And there was a BBC News report at the time that said banks, factories, and some shops had to close, as did schools and nurseries, leaving many fathers with no choice but to take their children to work. There were reports of men arming themselves with sweets and coloring pencils to entertain the crowds of overexcited children in their workplaces. Sausages, easy to cook and popular with children, were in such demand that the shops sold out. And, that's sort of the tongue-in-cheek sort of response. But this also led to massive changes in the Icelandic economy and in their political system. It led to their first election of a woman president, and it also helped to make Iceland what is now one of, oftentimes ranked as the best country in the world for women, in light of the policies that this day off helped to spark.
So what you just described was effectively all of the Icelandic women really taking a step back from their duties so everyone else felt the pain. What would it take to create a similar effect in the US? Because I feel like we've been talking about female caregivers, women and people who identify as women, as being the bulk of societal support since the pandemic, and nothing has really changed.
Yeah, I mean, I think one of the challenges is that we've used these kinds of myths that I was mentioning before to guilt and gaslight women into doing this work, even when it's taking a toll on themselves and on their families. And so I think it would take, to get that kind of broad level of participation, it would take women being willing to reject those myths, to being willing to reject the idea that they are supposed to do this work, that they are naturally better suited for this work, and also to reject some of the myths of things like meritocracy, which I talk about in the book, which women often fall into as a way to judge other women, to make themselves feel better about themselves or their own parenting, and even reject the kind of social safety net that might objectively leave their own families better off, simply so that they can feel morally superior to other families that struggle to get by without a net. And so I think to get that broad level of participation, it would take changing some of our cultural thinking, which is a hard thing to do, especially in the short term.
Was the Icelandic strike just one day, or did it happen over the course of many days?
So there was sort of one key day that happened in 1975, but it certainly led to ripples of continuing activism and continuing efforts on the part of women's organizations at the time.
So based on your research, if all women were to participate on June 24th and withhold their labor, both paid and unpaid, what type of effect do you think that would have on American society? Or would it need to go beyond the 24th?
I mean, I think certainly, I think if we were to get that kind of broad scale participation, it's hard to say exactly. I think people would take notice. We saw, even in the wake of Trump's election in 2020, massive kind of protests from women across the country that did lead to some change and arguably helped lay the groundwork for some of the policies that we put in place during the COVID-19 pandemic that, at least in the short term, helped families in tremendous ways. But at the same time, and as that example illustrates, especially given that we're unlikely to get universal participation among women, given these kinds of myths that we've been led to believe, we have to think about how do we sustain this effort over time, and how do we turn this one day of protests into a sustained organizing campaign, into ways of helping women to feel connected to each other, and to see the opportunities for using collective participation as a way to push for social change.
I've not seen a demographic breakdown of who is expected to participate, but I think one of the things I'm wondering is, will we see all levels of socioeconomic status participation here? Because if it is just women in white-collar jobs who are the most advantaged in society, and you still have women in lower income tiers doing that care work, manning schools, manning caregiving facilities, how different will the day really feel?
And that's the other key piece here, is that it's not just sort of cultural ideas that are keeping us stuck in place, but systems of exploitation as well. And I talk in the book about how this kind of reliance on women as our safety net, that the burden of that disproportionately falls to low-income women, and particularly women of color, because we often leave them, because of our sort of efforts to be this DIY society, we've underinvested in their families and communities in ways that leave those women kind of disproportionately, not only without the support that they need, but also essentially with nowhere to turn turn for support and nowhere to hide when other people ask them to fill in the gaps, to be the social safety net. And so what that means is that even if they want to take the day off on the 24th, there's a good chance that they know that if they are not doing that work, there is no one to fill in for them. And so that could potentially leave others, children, elderly people, the sick, people who need care and who can't take care of themselves, to fend for themselves in ways that could be deeply detrimental. And that's, I talk in the book about women who, want to take more time for themselves, want to try to, have that space and that energy to do more for their own well-being, but often feel like they can't let the other people down around them because the other people around them simply have nowhere else to turn.
And or they could receive penalties for striking, for not showing up to work, more than just a slap on the wrist. Some people could lose their job.
Absolutely. And certainly that gets at the idea that the safety net that we do have is not designed to protect people, particularly with things like attacks on unionization and the limited protections that we offer workers in our society that, many women that I talked to for my research didn't have access even to paid family leave after giving birth to a child. I talked to bus drivers, for example, who went back to work still bleeding in the bus seat while they were, because they didn't have access to any paid leave. And so we can imagine that, if the choice is to not get paid or, have this day off. I think we can certainly imagine that those who will risk their family's financial stability and security, those who will risk losing a job, especially given that we know that women are increasingly the primary breadwinners for their families, in addition to being the primary caregivers for their families. I think that shift will absolutely complicate things in terms of women's ability to participate in such a strike.
Now, working on this book, you talked to hundreds of women and pre and post the fall of Roe. Is that correct?
Yes. So we started the research in 2018 and 2019. We started by recruiting 250 pregnant women from prenatal clinics to ask them about the kinds of parenting decisions that they planned to make for their new babies. And I initially envisioned it as a study of sort of the best laid plans of parenting, how things go wrong and you have to adjust, and how do you cope in the process. And the pandemic hit in the middle of our data collection. And so we did additional waves of follow-up surveys and interviews with those moms and with their partners, and then also did two national surveys of parents from across the U.S. to better understand, how the data we were seeing on a qualitative scale kind of mapped on to larger trends across the U.S. as well. And so certainly, these kinds of shifts, not only in pandemic policy, but in terms of reproductive health care and policies on that front have played a huge role in shaping families' lives over the last couple of years.
Now, Jessica, as we approach the second anniversary of Roe v. Wade being overturned in the U.S., I'm curious, what did your research reveal is the tie between reproductive health laws, reproductive health access, and the way that women and families structure those families and make decisions about their lives?
Absolutely. So essentially, these attacks on reproductive freedom are making it easier for women to be pushed into exploitative relationships, whether that's in the paid economy or in their family relationships at home. And certainly this was happening long before the fall of Roe through the Dobbs decision, in part because states and many cultural organizations have been working for decades to try to make it more difficult for women to access abortion. In the book, I tell the story of a mom that I call Brooke, who actually never wanted to be a mother herself. She grew up in a kind of very difficult home situation, and at the same time, and like many young women, she ended up getting unexpectedly pregnant in college. And she and her boyfriend initially planned to get an abortion, and his parents even offered to pay for it. But her mother is very deeply religious, and ended up persuading Brooke not to terminate the pregnancy, and told her that well, I'll help you finish college, I'll help you raise the baby. But ultimately, when the baby was born, they figured out that they couldn't afford both college and childcare. And so Brooke ended up not only dropping out of college, but also, taking a low wage, signing up for welfare and taking a low wage job, which is required to be able to qualify for those kinds of welfare benefits, and even moved into a shelter to be able to qualify for affordable housing. And, this was deeply challenging for Brooke, in part because she, wasn't emotionally prepared to be in this kind of mothering role. And also because the best job that was available to her at the time was a low wage job in childcare. And she actually really liked that job, but it was deeply low paying in the sense that it was, even when she got promoted to assistant director of the center, she was still only making about $25,000 a year. And so that limited her options, particularly in terms of being able to go back to school and finish college, something that she really wanted to do, but felt as though she couldn't because she didn't trust her family to care for her son, so that she could take night classes, for example. And so she felt like she just had to kind of continue to make it work in this sort of low wage job. And that tracks with what we see nationally in terms of the fact that states that have been putting stricter restrictions on abortion and places where kind of cultural norms further stigmatize abortion, we see lower rates of college completion among women. We see lower rates of workforce participation. We see lower incomes for women, in part because, like Brooke, they often kinds of unanticipated pregnancies and the responsibilities that we heap on women in the process end up being pushed into low wage jobs and also into doing this kind of care work for their families as well. And so it's certainly, I think we can see how these kinds of attacks on reproductive freedoms will further limit opportunities for women and encourage, unfortunately, exploitation in the process as well.
It is what you've described as a vicious cycle. Women are the social safety net, and in turn, reproductive health policies are just making it harder for everyone to hold everything together, to kind of paraphrase the title of your book. I want to ask, having talked to hundreds of people over the last several years, having written this book, knowing that this anniversary is looming down on us, are you optimistic for any sort of policy change or for a stronger social safety net in the future, or are you left with a state of feeling a little more pessimistic?
I mean, I think there is the possibility of hope, at least, in the sense that this is a moment where women are seeing the need to come together to demand not only the kinds of protections that they need for their bodies and their families, but also the kind of social safety net that would help to protect them from this kind of exploitation and to make it easier for them and for others, particularly those who are in less privileged positions, to be able to fight back against these kinds of relations that our society is based on. And so, at the same time, we have to think about what will it take to achieve that kind of change. And I talk in the book about how what's necessary there is for people to reject the kinds of myths that encourage us to focus on just bettering ourselves in this system, and to recognize how if we can all see our shared relationships, and particularly how care links our fates, that we are all part of webs of care where we are at various points in our lives, both dependent on other people for caregiving and will be caregivers ourselves. And so if we recognize that we all participate in these shared webs of care, we can see that kind of shared identity and shared participation as a source of cohesion and as a way that we can fight together, despite the ways that the sort of engineers and profiteers have tried to divide us by race or class or gender or politics, to really come together to fight collectively for that kind of social safety net. Because, at least for now, we still live in a democracy. And so we still have the potential, at least, to vote collectively, to act collectively in ways that could help to reduce or limit the power of those kind of, small number of elites who are pushing the system to benefit themselves at the expense of everyone else.
Jessica Calarco, sociologist, author of Holding It Together. Thank you so much for joining us. We so appreciate your time and insight.
Thank you for having me.